good evening. Hopefully you've had a great week. It's Friday. Hopefully you're getting ready to sit down and have a great meal. But we're going to talk to you real quick today about an interesting topic, and that topic is, are all patients adjusted the same way? We've had a couple questions about what really goes on inside the room to other patients, not just themselves. So one thing I wanted to address before we get to that, however, is our sound quality. We've had a couple patients that have asked us to turn up the sound, and hopefully we're going to try to accommodate that today. However, we have purchased microphones and they will be here soon. Unfortunately, Amazon is a little bit slow these days, so hopefully those will get here by next week, and in our next video we'll have a little bit better sound quality. But hopefully you can hear this. If you can't, feel free to leave a comment and we'll try to talk up as best as we can. But once again, that brings us to our question. Are all patients adjusted the same way? So let's head on over into one of our adjusting rooms. And here we have, once again, Dr. Botros, and we're going to talk about some of those things that go on here, because not all patients truly are adjusted the same way. Talk to us a little bit about that, Dr. Botros.
So that's a really great question that I think we get quite often, and I think, if you go into a clinic and you see that the patients generally get the same kind of adjustments, it may seem that way on the outside, right? And the example I like to think of is if you go to a heart doctor and he's treating a lot of different patients with high blood pressure, it may look like he's doing the same thing, but there's a lot of different bones in the spine here, a ton of muscles that attach to those bones, and a lot of different ways that they can manifest. And so it might seem the same, but really between adjusting different segments, different vertebrae, taking the pressure off different muscles and nerves, it's actually a lot that goes underneath the surface.
And I always tell it to a patient when they come in, we're very efficient in how we work with patients. But from every second that a patient walks in the door, we're analyzing and assessing what that patient needs on that day. So each day a patient comes in, when we're stretching and challenging, we're actually testing every single vertebrae. So the adjustment itself might feel the same, but in actuality, we're adjusting different bones, we're moving them in different directions, but it's hard to perceive one bone different than the other when it gets adjusted. Now, each patient that comes in have different conditions, and so they require different skill sets as far as how those bones move as well. So tell us a little bit about some of the different things that we can do to move bones around the office.
You got it. So there's different techniques that we can use. There are instruments. We can put a little bit more firm pressure for those who have a lot of muscles and really need to get deep in there, or they're really fixated and stuck. Then we can also use very gentle techniques and very light pressure for those who maybe are a little bit more sensitive, or their muscles are really guarding that area, or they're really inflamed, for example. So here's, for instance, one tool that you might see us using. This is called the activator. And this actually applies a pressure that's really fast, so the human muscles don't have time to guard and tighten up on you when you do that. And it brings a very gentle motion into the vertebrae, into the joints. And if you do it on certain really tight muscles, it can actually help relax those muscles through a reflex in the body called the Golgi tendon reflex, for those of you who like to do your research.
It's really pretty interesting. There's all sorts of different ways that a chiropractor can kind of trick your body into relaxing so that those bones and muscles respond to the care that we're giving. A lot of times patients will walk through the office and they'll hear big bangs in different rooms, and they're always like, man, what happened to that guy? And I say, well, actually the loud sounds are actually usually a very gentle technique. And that technique is called a Thompson drop technique. And so parts of the table can shift up and down and allow for those bones to move smoother and freer. The doctor's name was actually Clay Thompson, and no, he doesn't play for Golden State. This was actually done in the 1950s. But the tables are still used today because of how effective that treatment is. And when we look at those different types of treatment, that brings us back to the old question of chiropractic, is that, does it have to make a sound to move? Does those bones have to crunch and crack to actually make an effect? And Dr. Botros, what's the answer to that question?
The answer is, as one of my professors once told me, don't become a crack addict, okay? And I love that expression. So a lot of times we get fixated on the audible, the sound of the clicking and the popping. But the reality is, it can be very, very beneficial to get the adjustment in, even if it doesn't make that sound. And again, when you go to a trained expert who is trained in this sort of stuff, we know exactly how much pressure to put in there, and sometimes less is more. And I've seen this especially, like for example, with car accident patients. I had a patient who got really banged up in a car accident, and you can barely touch him because he would just guard right away. Extremely sensitive and delicate system. And so I did the instruments on there, then gradually put a little more pressure. Next thing you know, we can get pretty deep and intense in there, and he was loving it and felt absolutely phenomenal. So the first few visits, we did not get any cracks or popping or clicking, and yet he was still continuing to improve. Whereas if we, let's say, put a lot of pressure all at once, it might actually guard the muscles, cause them to tighten up, and I don't think he'll be a very happy camper.
Absolutely not. And that's why all the care that you're given here in this office is truly tailored to your specific situation. Now, a lot of my patients know I love to hear those pops and crunches, and a lot of them get a lot of great relief from it. But not every patient gets those, and that's okay. Once again, here we both take care of small little babies, and a lot of times you're not going to hear huge pops and crunches out of little babies. They take very gentle care, very small movements to create a lot of relief. So like I said, there's a lot of different ways and techniques that we can use in the office to get a patient to their ultimate end goal.
Additionally, I always like to add, both of us as a matter of fact, if there's something that is uncomfortable or you don't like it, let us know. So we have many tools in the tool belt, and so we can modify accordingly. But yeah, with that being said, chances are we know exactly how to get in there to get you the effective treatment that you need, but still making sure that it is comfortable as well. Okay?
Absolutely. So with that being said, once again, if you guys have any other questions as far as the care that goes on here, the care that you're receiving, please let us know. If you have other patients or other people that have concerns or questions, let them know as well. We'll be happy to talk to them about their current condition and see if chiropractic is right and what path on the chiropractic pathway they need to be on to get to be where they need to be. Otherwise, how can they reach us if they want to get in?
Well, you can go to our website, chiropracticco.com, and you can look into the Glendale location and make an appointment with us, or you can give us a call.
That number is 414-332-0859. Chiropractic Company also works as far as our website is concerned. Feel free to Google that and you'll get our location. Like I said, click on Glendale and you'll be able to get to us. Otherwise, hope you have a great rest of your Friday. Enjoy your weekend, and we'll see you next week.